Hello and welcome to Let's Talk CanQueer, the show that brings you the biggest issues facing gender and sexual minorities living in Canada. I'm your host, Luke Smith, and with me are three incredible guests. I have David Snowdy with the Ottawa Police Service, Khaled Salam with the AIDS Committee of Ottawa, and Dr. Paul McPherson with the Ottawa General Hospital. This week we will be discussing the topic of the impact of the criminalization of HIV, which is a very, very important topic within the gay, bi, trans, etc. community. Before we get into that, I want you to quickly introduce yourselves and kind of who you work with and why this particular topic is of importance to you.
Great.
If you want to go first, David? Sorry about that.
Good. So as Luke mentioned, my name is David Snoddy and I'm Director with Ottawa Police Service. Prior to joining the Ottawa Police Service, a number of years with the public service at the provincial level, and prior to that worked for 11 years in HIV and AIDS work. So I bring a couple of different perspectives to the conversation this evening. And part of my job is to lead 3 sections at the Ottawa Police Service, including community engagement. And so for us, it's very important that we have good relationships with key partners and stakeholders in Ottawa so that together we can ensure that our mutual interests are achieved through dialogue, through opportunity to inform our practices and to help inform our members as to the best way to proceed on matters of sensitivity. So I look forward to the discussion tonight.
Excellent. If you want to go next, Khaled.
Absolutely, Luke. So my name is Khaled Salam. As Luke said, I'm the Executive Director at the AIDS Committee of Ottawa. The AIDS Committee of Ottawa is a not-for-profit social justice organization that provides education, support, outreach and advocacy to people living with, impacted by and at risk of HIV/AIDS in the Ottawa region. We have been serving the Ottawa community for almost 30 years. Next year actually is our 30th anniversary. The reason I'm here today is because of the issue of criminalization of HIV non-disclosure. It is something that has a very direct impact on the work that we do, particularly around the HIV education and prevention work. And I know we'll get more into details later on, but when the issue of HIV non-disclosure is looked at from a criminal lens, it's very detrimental and acts as a barrier to us doing effective HIV prevention work in the community. So I'm looking forward to our discussion as the show progresses.
Excellent, thank you. And Dr. Paul McPherson, if you'd like to let us know.
Yeah, I'm Dr. Paul McPherson. I'm an infectious disease specialist and an HIV treating physician at the Ottawa Hospital. The focus of my practice is, in fact, HIV. I also spend a fair bit of time working at the Gay Men's Sexually Transmitted Infection and HIV Testing Clinic downtown. So most of my practice is centered on both the HIV positive, but also some with the HIV negative people at risk.
Excellent. Now, definitely this is a huge issue in our community. There's been a number of cases, and we'll talk about that maybe a little later. We won't be discussing any specific cases. But kind of the impacts that the principle has in general. Just to let the audience know, just some information about HIV transmission here in Ottawa, to kind of give a local element to it. The Ottawa Public Health released a document called The State of Ottawa's Health 2014, and in that they actually noticed a drop in the rate of new infections. It went from 63 to 60, which is a great development. However, it's still above the provincial average. And HIV infections is the 12th most common infection in Ottawa, behind even chickenpox. So, very exciting stuff. So, what kind of what we're going to do is we're going to, before we get into what is, we'll get into what is HIV/AIDS. Let's give the audience a bit of a brief in terms of kind of what the disease is, so we can move into the real discussion. If you want to jump into that.
I'll start with that. Stop me when I've gone too far. HIV is, of course, a virus. It's known as a retrovirus. It's transmitted through blood and bodily fluids. When people acquire HIV, usually the most common is through sexual intercourse, and then injection drugs when the virus is acquired. It very slowly in most people attacks the immune system, and eventually over years the immune system becomes quite impaired, and that leaves people susceptible to what we call opportunistic infections, so infections that don't usually affect people with healthy immune systems. So opportunistic infections, malignancies, and things like that. So without treatment, HIV is a progressive terminal infection. In 2014, treatment for HIV is really quite excellent and fairly easy. The drugs we have now are quite well tolerated, and people who get on treatment, the drugs suppress HIV replication, the immune system recovers or is maintained in very nice functional status, and people on treatment with HIV these days can expect to live a very normal, healthy life with normal or near normal life expectancy. So the key, of course, is getting people tested, diagnosed, and on treatment so we can maintain good health for these people.
So how does that differ to AIDS? I want to just make sure that the difference is quite clear to everybody involved.
Right, so AIDS is really what we used to see far more in the past. So AIDS just means very advanced HIV infection when the immune system is at a very low state and people either have or are at high risk of developing the opportunistic infection. So that's a very far advanced stage of HIV infection.
Okay. So when we discuss HIV, we'll be implying at the most severe end of that AIDS. Correct. So just for the audience's benefit, if we stick with HIV, there won't be too much confusion there. You look like you wanted to mention something?
No, just think, correct. I think Paul has summarized the medical definition of HIV and AIDS very eloquently. So
I might jump in and say, though, AIDS these days is something we don't see a lot of, happily. People are tested and diagnosed and treated. So, HIV for people these days really doesn't mean AIDS. HIV means a lot of other stuff.
Mm-hmm.
And just to add something, I think Paul hit the nail on the head when he said the key is early diagnosis and ensuring that people get on treatment early in the game, and have the proper care and support, and is looked after from a holistic perspective to ensure good health. And HIV definitely now has progressed into being more of a chronic manageable illness, as you were saying.
And if I might comment, Luke, I think that one of the biggest myths that I continue to see today, and that I think challenges many communities and organizations, is a label or a diagnosis of HIV doesn't equate to transmission. Like there's so many variables in terms of the potency of the virus in that particular person, and I mean the expert here would know better, my colleague, but it's route of transmission and all those variables, and whether people are practicing safer sex. So there's many layers to this, and I think there's still a lot of myths and misconceptions around that aspect. Right. And all the more reason why we rely on really good community services to be able to help educate and clarify and demystify some of those myths and misconceptions.
I think you've touched on some really brilliant things, a lot of stuff which we will be getting to later. But before we do, I wanted to talk about, because this is an element that's played into a lot of case law around essentially the potency of the HIV and the transmission level. Are you able to speak to that at all?
So I'm not really sure what we mean by potency of the virus. The virus is carried in bodily...
Viral load.
Sorry. Viral. Okay. So the virus is transmitted in fluids. For transmission to occur sexually, two things have to happen. Now, essentially, we have to have a bodily fluid. So that's either semen, vaginal secretions, or rectal fluids, and those have to, from the HIV positive person, have to be exposed to a mucous membrane. So that's usually either the foreskin of the penis, the vagina, the rectum of an HIV negative person. David's absolutely right. There's a lot of things that increase or decrease the risk of HIV transmission. So the presence of other sexually transmitted infections at the same time can raise inflammation in the genital fluids, increasing the risk of transmission. Condoms obviously decrease it because they prevent contact with the fluids. Viral load is a topic of considerable discussion in the medical and scientific community. Some people believe if the HIV positive person is on therapy with a suppressed viral load, they won't transmit. There's probably very good data to suggest that that is not an absolute. Absolutely reduces transmission, but I don't think we can say eliminates. Transmission can be fairly complex if you get down into the nitty-gritty biology of it. So I think when we're talking to community and patients, it's important to keep it relatively straightforward. Transmission of bodily fluids, there is going to be a risk of HIV transmission. We have to remember that.
Absolutely. You look like you wanted to say something.
No, I was just when David was speaking, I was just agreeing with what he was saying. So I was going to add something, and then Paul summarized some of my thoughts as well. So.
Excellent. And now the reason why I bring that up is because viral load has been something that was brought into a couple of recent cases.
Right.
So it may come up a little later. So I want to make sure that everybody is our audience is on the same page. So yeah, does anybody else have any comments about that definitions for
No,
HIV?
just one thing I just want to expand on, because we'll get into the actual law and how it relates to viral load. So just to kind of simplify it, like viral load is basically the amount of the HIV virus that is in the bodily fluids that Paul was referring to, and there are medical tests to be able to measure the amount in somebody's blood, and that's the other key factor. The key thing to mention over here is that viral load testing, in terms of seeing how much virus is in somebody's body, is done on blood only. It's not done on the other bodily fluids.
That's a very important point. So that's the only fluid we measured in is blood. So the viral load in the blood does not necessarily mean the same as the viral load, the amount of virus in semen or vaginal secretions. They're often correlated, but by no means equivalent. So it's important to know that medically we measure in one body compartment the blood, and when it comes to sexual transmission, we're really talking about the amount of virus in another bodily fluid where we don't measure.
That's a really important observation to make. We will be getting into the topic of where the law stands at the moment, and what the concept of criminalization is, and how these other factors all fold into that as well.
Yes.
So we will be back very shortly with more conversation around the impact of the criminalization of HIV on Let's Talk CanQueer. Hello and welcome back to Let's Talk CanQueer, the show that brings you the biggest issues facing gender and sexual minorities living in Canada. My name is Luke Smith, if I remember who I am, and joining me today on the topic of the criminalization, or rather the impact of the criminalization of HIV, are three fantastic guests. I have David Snowdy with the Ottawa Police Service, we have Dr. Paul McPherson with the Ottawa General Hospital, and Khaled Salam with the AIDS Committee of Ottawa. So just before we left a few minutes ago, we were discussing kind of like what is HIV and what is AIDS. And there were definitely a few myths that we may not have yet busted. So how do you feel about busting some of those myths so that when we talk about the law and the impacts and the cultural impact, everybody's on the same page? So if you want to jump in with some of that, Khaled.
Well, so I think a good place to start would be, in the first segment we talked about what is HIV. We talked about how advancements in medicine have led to people living longer, healthier lives. If people are diagnosed early and get on treatment early, it slows down the disease progression. So HIV has really evolved into more of a chronic manageable illness. Having said that, as opposed to other chronic manageable illnesses, there is one big thing that separates HIV from other chronic manageable illnesses, and it really is the stigma that surrounds HIV. And that will tie in with non-disclosure that we talk about later on. Sorry?
Yeah. You mentioned chronic manageable illnesses. What would be an example of a different
like
one?
diabetes, for example, right? Where people are able to disclose very openly. It's not looked down upon, as something highly stigmatizing that only affects certain populations, or seen as something that is some kind of divine retribution for your sins. So one of the main myths around HIV, even in 2014 today, is that only certain populations are impacted by it. So if you're HIV positive, you must be part of the gay, bisexual, MSM community. You must be part of the sex workers community, or you must be part of the people who use drugs community. It's unfortunate that people have those myths and misperceptions around HIV in 2014. We know for a fact that it's not who you are that determines whether or not you are at risk for HIV. It's the behaviors you engage in. So HIV impacts all of us. And the behaviors we engage in really stem from certain social determinants of health. So if you have experienced violence in your life, if you have experienced homophobia, racism, you have a predisposition towards behaviors that put you at higher risk for HIV. So it's a pretty complicated social issue. So when people tend to kind of simplify it by saying if you have HIV, you must be gay, or you must be a sex worker, or you must be somebody who injects drugs, you see how harmful and damaging that can be, and how it becomes a barrier again in us doing proper HIV education and prevention work. So I actually would like to share a couple of staggering statistics for all your viewers, if you don't mind, around stigma and discrimination. Yeah. And this is taken directly from the National Survey Summary Report, CIHR Social Research Center in HIV Prevention at the University of Toronto and the Canadian Foundation for AIDS Research from 2012. So 16% of Canadians who were surveyed feel afraid of people living with HIV. 18% would be somewhat or very uncomfortable working in an office with someone living with the illness. 23% expressed discomfort shopping at a small neighborhood grocery store owned by someone living with HIV. 35% would be somewhat or very uncomfortable if their child was attending a school where one of the students was known to be living with HIV. 54% would be somewhat or very uncomfortable with a close friend or family member dating someone with HIV. So just to give your viewers a sense of some of the, like I said, shocking statistics in terms of how people perceive HIV, even in this day and age.
Mm-hmm. That's really quite incredible. I wanted to quite briefly touch on, how debilitating is HIV. You mentioned it was a manageable chronic illness. I believe that you mentioned in the earlier segment that that the treatment is tolerable. So what does that really mean for people living with HIV?
So without diagnosis or treatment, HIV is a very severe illness, and that still is with us today, if people don't get diagnosed, we do still have people coming to hospital with very advanced disease, what we would have or still can call AIDS, if they have either didn't know they were at risk and didn't realize that they should have been tested, or perhaps knew they were at risk but were afraid to go get tested. People who are tested and get on treatment, most people will do very well, but it is true that managing your HIV and keeping your virus controlled does mean taking pills every day for the rest of your life, or at least until we find a cure, for which there is nothing on the horizon just yet. But I say we remain hopeful. But right now there is no cure, so it means taking your pills every day for the rest of your life, which is not as easy as it sounds. If you talk to anyone with diabetes or any other chronic illness, daily medication is not an easy thing to live with. But for those people who can and do that, and there are lots, they will do very well.
I mean, Khaled, you work with, obviously, with people living with HIV/AIDS. What does that look like with your clientele? So,
I mean, I agree with everything that Paul said. So HIV, if it's left untreated, undiagnosed and untreated, can be a very serious illness with opportunistic infections, like Paul had referred to, potentially leading to death. So it is a very serious virus that can have serious health complications for people if left untreated. But folks who are on treatment are able to live non-debilitating lives. But having said that, there are debilitating impacts of HIV, and some of which I mentioned when I was talking about stigma. So when people are disclosing their status, for example, whether it be to a family member, friend, employer, people are often shunned and ostracized. In some cases, people are met with violence. So those aspects of HIV, even though medically it's gotten a lot better, it can still have debilitating impacts on people in terms of psychologically, emotionally, and obviously we'll talk about the criminalization piece, right? So there are still many debilitating aspects of HIV that are non-medical, if that makes sense.
It certainly does. It's important to account for both the medical impact and the social impact equally. Yeah. Moving briefly now, well, not briefly, we're moving now to kind of like how the law intersects this. So what is the law that is being used, or is most being used, in terms of what people see to be the criminalization of HIV?
So you're looking at me.
Sorry, David.
That's okay. So first of all, I just want to qualify. I'm not a police officer. I'm a civilian member, and I'm not a lawyer by training. So I need to rely on the same information that's available to any member of the public in terms of, what constitutes a good answer for that. And I think one of the distinctions that I would draw is that there is no law specific to HIV. What there is a Supreme Court decision. And what that's translated to in practice is using parts of the criminal code in order to respond to complaints that have come in where people have been accused of non-disclosure and or other forms of a sexual assault and other types of criminal behavior. And so that then, I think as we get into the conversation, we'll see has tremendous impact in terms of criminalizing HIV as opposed to the conversation that we talked about earlier, which is, is the legal system the right way to, deal with what is largely a health and social complex issue. But we also have to recognize that the decisions that have been made are influencing the way in which law enforcement and other aspects of the judicial system interpret and use that information to respond to situations that come forward.
Can I jump in with some, just because I think it's important for clarity. The phrase criminalization of HIV is not a good one, right? There is nothing criminal about HIV whatsoever under any circumstance. What the discussion on this topic is the issue of non-disclosure where there is a risk of transmission. So I just think that comment, criminalizing HIV, is really fear-inducing and inflammatory. I think we have to be very specific about what it is we as a community are talking about. We're talking about HIV transmission or non-disclosure of HIV status where there is a risk of transmission.
Absolutely. And to build on what David has already mentioned, so basically the legal obligation to disclose one's status in terms of somebody living with HIV really was established in the 1990s. Unfortunately, the Supreme Court decision that came out in 2012 has basically created harsher laws around the issue of non-disclosure of HIV status. So what the Supreme Court basically said, to simplify it as much as I can, is that someone living with HIV has to disclose their status to their sex partner prior to engaging in sexual activity when there is a realistic possibility of transmission. So that creates a lot of complexities in terms of what does, quote unquote, realistic possibility of transmission mean, and it leaves it wide open to interpretation. Whereas before, it used to be, quote unquote, significant risk of HIV transmission. So there's a massive shift from significant risk of HIV transmission to realistic possibility of HIV transmission. So that really complicates, things for us, and obviously has the biggest impact on people living with HIV. The Supreme Court basically said that a person does not have a legal obligation to disclose if two things happen in combination. One, there is a use of a condom, a proper use of a condom, with a low or undetectable viral load. So if you have the combination of having a low or undetectable viral load with the use of a condom, then you don't have the legal obligation to disclose. Now, I feel that the decision has oversimplified a very complex social issue. So even when you look at in terms of having a low or undetectable viral load, in order for somebody to have a low or undetectable viral load, they have to get tested and be diagnosed first, and this particular Supreme Court decision deters people from that process in many cases. And B, if you're aware of your status, then you have to be on treatment to be able to achieve a low or undetectable viral load. Not everybody is in a privileged position or has equitable access to medical care to be able to get to that point of having a low or undetectable viral load.
Where you can join us back at Let's Talk CanQueer, discussing the impact of non-disclosure of HIV in the Canadian context. Hello and welcome back to Let's Talk CanQueer, the show that brings you the biggest issues facing gender and sexual minorities living in Canada. I'm your host Luke Smith, and joining me still are the fantastic Dr. Paul McPherson, Khaled Salam and David Snoddy. We really left at a quite heated moment in the conversation, and I think it was really interesting. I was corrected for the term criminalization of HIV, and rightly so. It was, we're definitely looking at non-disclosure, and we'll get more into that in a few minutes. But what I wanted to really get a grasp of, and we discussed this briefly in the break,